Who here has a laryngeal dystonia? Okay. So what is Botox? Botox is a component that makes muscles weaker. Okay. So sometimes it's hard to think. So if you're making the muscles weaker, how does it make the voice stronger? And the idea for each of the different pathologies we're going to talk about is there's a different thought process to why the Botox works. And plumping up the vocal folds with a filler material, which is the opposite of Botox, right? Filler makes it bigger and plumpier, and Botox paralyzes. And so here it is going through the camera. So all you're seeing is the channel and the needle. And a lot of times I'll tell my patients, if they're also getting cosmetic Botox, to try to do it very close to their laryngeal Botox so that the body doesn't have.
Patients, as Elijah said, this is really what allows us as clinicians, as researchers, as educators to really understand what the needs are. This is all controlled at the higher level, the brain. The brain sends signals to all of these muscles, the respiration muscles, the laryngeal muscles, the voice, the vocal cords. When folks have a stroke, injury to the brain, and develop dystonia, it's in this region of the brain, the basal ganglia, but not always.
We actually met you for the first time at one of our virtual meetings with Ron. So thank you again, Ron, for connecting us with you. The human voice is the most beautiful instrument of all, but the most difficult to play.
The reason research is behind, is not because there's no research to do. It's because there's a lack of funding and interest. And that's why Kim and all the organizations here, you guys are making such a difference advocating for this disorder, because that's what's going to make a difference.
My voice comes and goes. And as I'm aging, we all are, it goes more frequently than it used to. I was diagnosed over 30 years ago, and I'm going later this month to be retested because no one's ever retested me to see if I was diagnosed properly in the beginning. So from what you said earlier, when I get to the doctor, if I'm having a good voice day, is she going to be able to tell anything? Or would I be better asking if I can book it as an emergency when my voice breaks?
That's a great question. I think that's one of the things that also frustrates me. If right now with our current care, we can only see when you come to our office, right? So remote evaluation, remote diagnosis is going to have to take a bigger place in our lives, right? You can't only be assessed when you come to the